What does alternative healing for animals mean?
We can start bark flower, we can start physio exercise, lifestyle modification changes.
Does homeopathy and these alternative healing methods help with reactivity in animals?
Observe the dog, observe the owner.
Animals understand our energy.
Yeah, acupuncture helps with almost everything other than curing cancer.
Help your vet help your animals better.
There are remedies for fear of known things and fear of unknown things also.
All the podcasts, Lana, and she poses.
Talking about acupuncture, I myself am afraid of needles. So like,
Oh,
I
are you?
so when your energy is calm,
Yeah.
you're going there with a positive intention to heal that animal.
Animal Welfare Center, do they reach out to you to figure out ways of reducing stress for their multiple animals in their facility?
I'd been to Korea, I'd been to Indonesia. They have incorporated this as a part of an education curriculum in the vet school itself.
You're sending medicines abroad?
There are some remedies in homeopathy that can help save a life also.
How do you navigate your own emotions, doc?
Just to make the pet parent understand that something like this exists and it will definitely help your pet.
So I feel responsible pet parenting
Yeah,
is something we need to work towards in our country, you know. I hope you're on Rescue Remedy, doc.
Yeah, sometimes it's required.
Today we have a very interesting person at the podcast. He's not only a skilled veterinarian, but he is also doing alternative healing modalities for our animals. Dr. Akshay Shah specializes in acupuncture, bark flower remedies, low-level light healing therapies. I'm going to get him on and let's get this conversation going. So, Doc, I have lots of questions, but first I want to ask you is, what does alternative healing for animals mean?
Alternative, as the word says, it's something else that you want to try. Allopathy is the streamlined conservative medicine which people have been doing throughout ages.
Yeah.
Alternative healing has also again been there throughout ages, but people are not aware.
Or
So, tried, yeah, not explored. So
Too
that's
much.
like an alternate therapy I want to try for my pet.
Yeah.
So I am or my pet is done with allopathy. He is getting side effects. Kidneys are going,
Feeling, yeah.
liver is going. What can we do to help our pet?
Yeah.
So in such scenarios, alternative therapies like homeopathy
Yeah.
or acupuncture will help to make your pet more comfortable,
Yeah.
relieve him from the pain, reduce the suffering,
Yeah.
make it more easy for the pet to stay in his day-to-day activities.
The day-to-day quality of life
and
goes
improve
up.
the quality of life.
Yeah.
Like that's
That's the main aim.
final years of your pet's
Yeah.
life. So make it more comfortable and happy for him.
So that's alternative
Yeah.
therapy. So how did you get into this alternative healing space?
So alternative healing has been it's a completely different modality or way of treatment as compared to the allopathic medications. So these medications, while reading up about it, and dogs, you can't use painkillers for senior dogs, and it affects the internal organs in the long run. People are just using antibiotics just like chocolates. They are like, my dog got loose motion, so last time you had given Metrogyl, that's an antibiotic, so we just gave it for 2 days, he was fine in 2 days. People don't complete the course.
Correct.
It's an antibiotic, it's going to work
Yeah.
and you'll see results. But then in the long term, when you just cut short the course, you don't complete the course, you just use any random antibiotics without the knowledge of which antibiotic is good for what kind of a condition.
Yeah.
This is how, because of the misuse, all the dogs are getting resistance to the antibiotics.
So even vets are prescribing it easily as well, I believe.
Yeah. Because
we have to be a little careful
Yeah,
about
you have to
that,
be
right?
careful. See, it's like result oriented.
Yes.
Antibiotics, steroids, painkillers,
Yes.
all these things will give you quick results.
Yes.
But in the long run, they are spoiling the
Yeah.
body without your knowledge.
Yeah. Because a vet was telling me that by 2030, antibiotic resistance is probably, or 2050, it's going to be at par with cancer.
Yeah, and there's
As per some papers, which is
because
scary.
Of research and
In
on how
animals?
much, and that too in animals rather than like humans, it's
Yeah.
okay. Like
Yeah,
humans
but
also,
in
I have so
animals, it's gonna
many
be,
friends who just pop antibiotics just
Correct.
like for the
Quick relief, yeah.
But then that's not a good picture that we are looking at.
Yeah. So, Doc, tell me what made you, I know this, that because you wanted to try all of this out, and how long have you been doing this, and what all do you offer in this alternative healing modality?
So like there are multiple therapies that I do. It's more like acupuncture, homeopathy, bark flower therapy, lower level light therapy. Then there is nutrition. We can change the nutrition. All these are alternative small things which we offer, to make the life of your pet easy and more healthy.
Yeah.
Without any side effects.
Yeah, because I remember with what I met Dr. Akshay because he came and did acupuncture for my dog, which my vet, Dr. Nicole, recommended, you know, and I saw the difference in that day, if you remember.
Right.
I mean, Watson had a degenerative joint disorder, and it became palliative care for him because he was a senior dog. And instantly on the day, and we used to do it twice a month or twice a week.
We started twice a week, and then we tapered off.
We tapered off when he was a little better. And you could instantly see in a few hours that he was being able to walk better.
Correct.
Instantly, so that was amazing, Dr. Lee.
But that's
Thank you for that.
It's commendable that you and you all, look into the minute details. Like this is how pet parents should be.
Thank you.
That you should observe your pet.
Yeah.
Then that's how you come to know.
So also, Doc, like, I mean, certain breeds are prone to certain things, right? Yeah. So labs, for example, hip dysplasia and bulldogs, joint disorders, breathing. So acupuncture helps with the breathing as well? Or?
Yeah, acupuncture helps with almost everything other than curing cancer. It does help to reduce cancer pain. It doesn't cure it directly.
Yeah.
But yeah, in anything and everything, there are points for
it's amazing.
For treating the body.
So, Doc, do you have any memories of your first few cases when you started working that you saw a transition? Do you have
because first few cases, talking about acupuncture, I myself am afraid of needles. So like, how will the dog feel about getting poked?
Yeah.
Because my father does for humans, so he used to poke me for whenever I used to get it. I don't know, I don't want that.
Yeah.
You give me medicine.
Yeah. You were afraid of needles. That's amazing.
So then now, after seeing the way it works, and for myself also, the results which I see, like the relief which I get post a session.
Yeah.
So then I was like, let the tablet be.
Yeah.
This is more helpful.
I didn't know you were scared of needles, dog. That's
amazing. But now that has changed over time.
Yeah.
So then for homeopathy also, I was like, will it work? Will it work?
That's
it's the biggest, new thing.
Yeah, and it's a very big debate that's going on outside of this space also,
but
right?
Me trying it for the first time, and then slowly, as you understand the subject, as you understand how the remedies work, on what cases what works, then you become more confident and like, it will definitely work. So it's like that.
Do pet parents come to you at a certain stage with their dogs? Have you noticed that?
Yeah, it's more like in the end stage when we've tried this, we went to this doctor, we've shown so many doctors, we've done all the possible treatments.
It's like the last option?
Yeah, how can you help us now?
Do you feel if pet parents came earlier?
Yeah, it does make a difference.
So this is something to consider from the beginning?
Beginning, yeah.
So even as a puppy?
If you know your dog is prone to that kind of a disease condition,
there's no harm consulting?
Yeah. And at the early stage, if we start treatment, not even only acupuncture, like other supplementation or homeopathy to keep the joints healthy, to prevent the wear and tear. Yeah. Small things like exercises.
Because I mean, my thing as a pet parent is when a puppy comes, that zoomy stage, right? And I remember Watson used to zoom and jump on the bed and then zoomy and then jump on the sofa. And then later in life, I realized, I was like, oh no. I mean, obviously it was that puppy stage. And then I had to build ramps for him and steps for him to get on the bed. Maybe if I'd built those ramps a few years earlier, if I knew earlier, I hadn't researched all of that, right? Because you're in that puppy enjoyment stage. You're so overwhelmed with that. But this is something to consider, and I guess do vets advise this to pet parents from a young age?
They should.
I think डर लगता है ना. What is it? बताते क्यों नहीं है?
No. It's like kind of a thing that,
It's your relationship with that vet.
Vet or comfort, but the priority should be the pet.
Exactly. But I think I think this is something we should consider, because it, so like let's say about pet loss. What stage do you start preparing do you prepare your pet families for them? You start from there.
Because they are here for a short time to change our lives.
Yeah.
it's not like we do make a difference because we are everything for them.
Exactly.
So they put their 100% to make our lives happy.
Yeah.
They understand us, they feel our emotions, they feel our suffering.
Yeah.
So they try to comfort us. So this is there in the back of the mind that someday he's going to go before me.
Always.
Yeah. So that.
I mean, I always wanted my dog to outlive me, and I prayed for that. Because I was like, I can't handle it, and I was just so scared. But yeah. So do you start talking about this to your clients, dog?
Yeah, but now most of the clients which come are like end stage only. So then to counsel them, to make them understand that
it's
what
hard.
he or she is going through. Someday we also have to go through that.
Yes.
And that understanding needs to be there, and that acceptance needs to be there. Yeah, this is going to happen, and it's something which is not in your hands.
Yeah. So perhaps if vets, with your regular clients, if you all started earlier, right, when you've built a rapport with that pet parent and they're going to coming back, perhaps once in a while just throw in this, in a conversation.
Some realization should be there.
Yes, because I feel, even if you remember, I was pretty clued in, but I was not ready. Like it was still hard. It's hard,
it's hard.
to deal with this. But I feel if you prepare, I mean, thoda comfort aata hai kahin se, I don't know where, but I think just being
mentally, and you're
mentally
prepared,
but I don't think mentally, I think everybody knows that their dog's gonna go.
But still some people don't.
Think, that is one. But I don't think you realize the emotional impact it will take on you watching your dog age and then have senior dog ailments. I don't think that is considered, or you just kind of try and avoid those thoughts. Do you recommend that pet parents start taking videos of their dogs to show their vets?
Yeah, then things become easy because there's no...
Otherwise, it's just the talking doesn't explain too well, right?
Because it's a similar case. The pet parent, like, my dog is having a seizure. Like, I don't know if it's a seizure, if he's choking, or what's happening.
So please take a video. In these situations.
Or the way he's walking.
Yeah.
Or if he's limping from the left leg, when they come, he's limping from the right leg.
Yeah.
So then it makes diagnosis easy.
Because you're not fortune tellers, no?
Yeah.
I mean, you need to see stuff.
Yeah.
So help your vet, help your animals better.
Yeah,
right?
It doesn't make a difference.
Have your medical history in place. Have enough videos in place to show your vets.
Because I remember you used to send me videos of what he's walking this way and walking that way.
Because it was, I didn't know if I could explain it. Sometimes I just feel we all perceive the world individually.
Right.
So what I'm seeing and you are seeing is probably different.
Completely different.
Right? So and how can I risk that with my dog?
Right.
Like, I might be being a hyperactive mother, dog mom, saying ye ho raha hai, wo ho raha hai, ye ho raha hai. But I want you to see, but that's me, and I hope that a lot of people
do that.
Yeah, don't be as crazy, but do as much as you can. So I want to talk about bark flower therapy you do as well, right, Doc?
Correct.
So I believe for homeopathy and bark flower remedies, that when you take down the history of the pet, do you also take of the pet parent?
Yeah, that's important, because bark flower, as you mentioned, it works majorly on the mind symptoms like behavioral issues, psychological issues.
Yeah.
So to know the mindset of the pet parent is also important.
The emotional history.
Their anxiety levels.
Yes.
So that affects the pet as well.
Similarly, right? Because it's energy connection.
Yeah.
And do you recommend that the pet parent also go on the homeopathy remedy with the
homeopathy
pet?
Or bark flower, it's better. Homeopathy, again, it's different, but bark flower, yes, I do.
Yeah, because I remember I was put on, when Watsi was put on rescue remedy, I was also recommended to take rescue remedy with him.
Yeah, because our anxiety also, it calms down, our emotions calm down a little bit.
How does it work?
So these are basically flower extracts. It's a completely natural thing.
Yeah.
People believe, people don't believe. When they use it themselves, they understand.
Yeah.
But so each emotion, each flower or each remedy is attached to some kind of emotion in your brain. Same applies for humans as well as animals.
Yeah.
So animals do have emotions as well.
Yeah.
So to understand that emotion, for example, if your dog is afraid of something, so there are remedies for fear of known things and fear of unknown things also. So
like, can you give an example?
So fear of unknown things is like fear of the dark, and you don't know what next is there behind that.
Yes.
But that's kind of a known fear, but again it's an unexplored fear.
Yeah.
And fear of known things like patakas, loud noises, thundering, cars, dogs run behind cars.
Yes.
So those things. Then some dogs who come, so the pet parent were like, my pet, he was a male only, but he was afraid of human males.
That happens a lot, Doc.
Yeah.
I've noticed that a lot of late. Why?
And he's comfortable with female. So I have another doctor, she's a female. So dogs, he went to her nicely.
But some dogs, that's a different trauma story that's going on, right?
So then we have to understand the background of it to formulate a remedy for that.
Yeah. That's very important.
And then again, separation anxiety also is a major issue in the city.
Yeah.
Because all these COVID puppies, now people have started working. Just yesterday only, they bought a puppy and that puppy started biting. Now that's his nature. It's growing, it's teething, it's going to bite.
Teething.
Yeah. And you're like, nahi, humko nahi chahiye, we don't want the dog.
Why?
I'm ready to give it away. And then another pet parent was there. He got so pissed on him. Like, sir, okay.
I think, so I feel responsible pet parenting is something we need to work towards in our country. You know, like I always say that before getting an animal, you have a bunch of things that you need to consider. One is your lifestyle, your time, your emotions, and finances. Dogs and animals are not cheap.
No.
And it is a commitment of 10 to 15 years. So this just picking up a dog because you want.
And in the end, it is going to be more.
Yeah, it gets, and of course it is. And you know, perhaps if we can inspire people to first start fostering.
Right.
Before deciding to get an animal, you kind of know what you're getting into. You know, like, I mean, 90% of those fostering becomes failed fosters because you can't give the animal. I mean, I'd probably be a failed foster once an animal comes to me.
Then
there's no chance. I'd let it go somewhere else.
But such people should visit shelters and understand.
Yeah, you know.
And educate themselves.
And Doc, you do something called
low-level light therapy.
Low-level light therapy. What is that?
So this is more like laser and low-level. It's cold light therapy.
And which illness does this?
So that again helps with musculoskeletal issues, for arthritic pain, for spinal pain.
Okay.
Then low-level light therapy also helps with skin issues. Like there are different wavelengths of lights which help stimulate the cells and help tissue repair.
Oh wow.
So each wavelength has its property. So that way, for example, for skin issues like a dog with mange or atopic dermatitis, to reduce the itchiness, to help bring healing of the skin. Then for arthritic pain or degenerative joint disease, on all these conditions, different wavelengths, they help reduce the inflammation in that area.
Wow.
So, and it's again non-invasive, it doesn't heat up, it's non-painful.
How have you seen a change in pet parents reaching out for alternative healing for their pets over the years since you've been working? What is your experience been with that?
It's been a difficult journey.
Why?
To be honest, because people, they don't accept like this thing will help my pet. Will homeopathy help my pet? I don't believe in homeopathy. Or just giving sweet pills. Or what is that going to do? So that mindset still has to be changed. But once they see the results, once they understand how it is helping, then they are more, I didn't know this.
And do they tell their friends also about it?
Yeah. Once they come to know the benefits, then they want others also to take that benefit.
Yeah. Do you have any memory of any particular case that came into you saying no, and then saw the change in their pet?
Yeah, recently only. Then why are you putting needles? No, I'm afraid of needles. No, you can wait outside. I'll do. Your dog won't resist anything. He is comfortable. He is accepting the needle treatment. And then they realize,
and did they see the change like I saw with Watsi?
Yes.
Yeah, because I remember with Watsi, we had to distract him with Kira.
I remember.
While he ate his Kira, he got his acupuncture done peacefully. Are cats more receptive to homeopathy or dogs?
Dogs, in general, and anyone. It's more homeopathy again. It's more like, if you say that again, is also one of the principle is based on the vital force. That is again energy in the end.
Yeah.
So energy levels as receptive like a dog, cat, human. It all varies, but yeah, cats, dogs, more or less similar.
Similar. So, what all animals can you do acupuncture for? This is just a general question.
Generally,
all the large ones?
Large ones.
Cows, buffaloes?
Buffalo. I've done for horses also at the race course.
Oh, you have?
Yeah.
Oh,
so
wow.
For horses, it's used quite.
Yes,
widely.
because especially the racers, no?
Yeah.
Oh, wow.
Cows, buffaloes, goats, sheep.
Yeah. My sister had done something called Bowen therapy. Bowen therapy? What is that?
Bowen therapy.
Yeah,
it's
so
kind of a massage therapy. And again,
she done it for her lab.
Yeah.
Ah.
So that's also,
that also helps.
It's type of an alternative therapy. It helps, yeah.
So there is a
massage
lot.
therapies are different. Like there is, I think, craniosacral therapy, then Bowen therapy.
Yeah.
All these are different type of massage. There's Tuina. Tuina is a different type of massage in which movements of your fingers, your palm, the way you're massaging the pet, and that helps relax the body.
Yeah.
And helps reduce the muscle fatigue, muscle tension,
Yeah.
or muscle, if the muscle is injured, it helps healing. So Tuina massage is also that's a Chinese kind of a massage.
How interesting. So you do that for animals?
Yeah, we do that also.
Wow,
Yeah.
that's so cool, doc.
Acupuncture I'd done in the zoo for a hyena, then
wow.
for birds, turtles.
You go to the zoo as well?
Yeah,
So you're
yeah.
doing wildlife acupuncture? Really?
I have done for the Mumbai Zoo hyena.
Oh, wow.
Yeah. It's an old senior hyena.
How did the hyena respond?
He was in quite a lot of pain, but yeah, it helped him. Like acupuncture and low level
How do you
light
do it
therapy.
for a turtle with the shell?
No, there are points along the legs and near the neck and the hind legs.
How wonderful.
Yeah.
Oh, wow. So what kind of challenges do you face, Doc, basically with this? Any particular challenges when you initially started?
Just to make the pet parent understand that something like this exists and it will definitely help your pet without him being troubled.
That is the main thing.
Yeah.
And they're open to it. So as of now, how many doggies or cats do you have?
Many.
On treatment in homeopathy?
Daily.
Yeah?
Daily basis, many. Now people are becoming more aware.
Yes.
They want to explore.
Yeah, that's what I'm saying.
Something like this is there, I want to try it for my pet.
Do you work in tandem with other vets for this? Do they recommend?
Yeah. Again, that is an important thing because when other vets, they know that someone is doing this.
Yes.
And they are also open to try this.
Yes.
Some vets, unfortunately, are not open to try this.
Yeah.
But when they see results, then they inform their clients that something like that. Why don't you try it?
Yeah.
Like that.
So that's good. Where did you study this? Is there a course for this somewhere in India?
Yeah, not in India, unfortunately.
Okay.
But you have to be a vet first to study. Yeah. So there's a university called as Chi University.
Okay.
So now, luckily, I've become a board of director for the World Association of Traditional Chinese Veterinary Medicine.
Oh, wow.
So hopefully I want to start something in India.
Nice, dog.
For vets to learn acupuncture.
So you had to go and do it over there?
Yeah, they're based in US. So
okay, so you went there to do it.
Yeah.
And so there's no course in India as of now.
No.
So it's time for you to open it up, dog.
Hopefully.
Yeah, really.
Yeah.
To help
So then
them.
again, this is a challenge.
Yes.
The universities are not open.
Yeah.
So now I'd been to Korea, I'd been to Indonesia. They have incorporated this as a part of an education curriculum in the vet school itself.
Fantastic.
So then young vets, they know, I have an option to do this also.
Yeah. But are there but there are a bunch of vets doing this,
yeah,
right?
2-3
India.
vets, yeah.
Oh, is it only in Mumbai?
Yeah, Mumbai only.
Only in Mumbai these vets are?
Yeah, there's no certified vet. People are just randomly studying and then just poking needles anywhere.
Oh, no.
I wouldn't recommend that.
So certification is important.
You know what you're doing, right?
Yeah.
In the end.
Yeah, it's important.
See, that needle is not going to cause any harm or anything. But
you still need to know what you're doing. You said that there are... So homeopathy courses to hoenge idhar?
Yeah, so
For
homeopathy
animals?
Yeah.
There is.
For young vets who want to know, Kerala Veterinary University, they offer and long distance course in veterinary homeopathy itself.
Okay.
So it's a 6 to 7 month course. You have to just go there for admissions and exams, and rest everything is online.
That's amazing.
So I have encouraged quite a lot of young vets to, go. No,
Yeah,
you
why
can try
not?
it out. It's just an additional thing. in
your field,
or in your treatment modalities, that you have something else also to treat when something doesn't
and
work.
it's interesting because a lot of families would like to try this out. I
Right.
don't even know if people knew this was an option,
Right.
for their animals, and I hope you get a lot of calls after this.
Hope so. And then try to help a lot of cases.
What all is available here?
So there are a lot of online modules which are available for which you don't have to travel.
Okay.
Because as a young vet, money is also an issue. Like
Yes.
to spend so much for traveling, to invest so much in some kind of thing which you are not sure about.
Yeah. So can vets and like people who want to help in animal thing come and volunteer with you?
Yeah, a lot of
Interns come?
They come
Okay.
to learn, to understand, and then
Even what about shelter managers? They can also come?
they can.
And
So you can educate them about bark flower therapy, basic things which they can do themselves.
Yeah, that'll be good.
Yeah.
I was so nervous with Watsy when you came, but I remember when he turned around and tried to snap at you, you didn't flinch. Like, and Watson just looked at you like, because he's so used to people responding to his kachak.
Yeah.
And you're like, fine, I give up. Do what you want, So what's your secret trick on getting animals comfortable with you? Because I know you have a secret because that composure that you have. Please share.
The secret is like you need to understand the animal. You need to understand their emotion because they can pick up your emotion within a second.
Animals understand our energy.
Yeah, they understand our energy. They understand our body language.
Yes.
And the way you approach them.
Yes.
So if you're scared and they can understand from your smell, like our body releases some chemicals when we are afraid, and they pick it up fatak se.
Yeah.
And then
they'll play you.
Yeah. So you need to be calm, composed. Like as you said, energy is also
so important, Doc.
So when your energy is calm, you're going there with a positive intention to heal that animal.
Yeah.
Then they understand, they pick up our energy.
So like, what are some steps that you do to get the dog comfortable? Like the owner can keep saying, my dog is this, but I know you're not listening to the owner, you're watching the dog. I know that. So please elaborate a little bit on that.
Observation is a big key to it.
Observe the dog.
Observe the dog.
Animal,
observe the
cat.
owner.
Yeah.
If the owner is talking to us, you can please calm down. Please take a seat. Let me interact with the dog. Even as a general human also, if you're approaching any pet, dog, animal, like any random, you need to be, you can't just go and grab the dog, pet him. You don't know how he will react. So just observe the pet, see how comfortable he is coming to you.
Yeah. And so like you give them time, right?
Time is important. Yeah.
You have to give the animal time. So even when you're doing stuff at the clinic, you pace out your appointments so each dog
that everyone gets proper time.
Proper time is important, right? Do alternative treatments work in tandem with allopathic or do you have to choose?
So there are some people who want quick results.
Okay.
So alternative therapies do give quick results.
Yes.
Not that it takes, some people consider homeopathy takes time, but there are some remedies in homeopathy that can help save a life also, like within few seconds.
Okay.
So things are as quick as that also.
So do you have to do two? Can you do both together or you have to choose one? Or it's up to...
some people they want both together, but I would prefer choosing alternative. So then go for alternative. In alternative there are multiple things. Not that we are just doing acupuncture, homeopathy. There are multiple things.
So what all do you do?
So we can start bark flower. We can start physio exercises.
Yeah.
We can start lifestyle modification changes.
Yeah.
Along with all these things.
So lifestyle modification changes would have what all in it? Food,
the environment, exercise, like how you had, I remember you had put floor mats for Watsy.
Yes.
So these small things, when people are supportive to, get it done for their pets, it makes their life easy.
Yeah. Yeah, and his trolley.
There's so many things you had done.
What's the number one thing to keep in mind as a pet parent when they come to you for their pet's health?
So they should be open for, understanding and accepting other treatment modalities also.
Okay.
Like normal allopathy we'll do.
Yeah.
I'm fine with that. But again, for alternative therapies, you should be ready. Something like this can help my pet.
Yeah. And also have your animals history, dog?
History, yeah. People don't know what is the dog is
Let's
eating.
Let's talk about that, right?
People are not aware. They are just keeping pets. I'm sorry to say, but it's the reality in the city. Like people are just keep buying pets. Why you adopt pets? There are so many breed dogs who have been abandoned.
Yeah.
Adopt them.
Yeah.
Give them a good life.
Yeah, I think that awareness. I'm hoping this podcast
Yes,
raises
hopefully,
awareness for people to consider. So it's not just about adopting an indie. You can. There are
Anything.
multiple breed dogs across
Dogs,
welfares
cats, there are
across India. So many
a lot
animals.
of animals. Yeah.
Does homeopathy and these alternative healing methods help with reactivity in animals?
Yeah, it does. Because again, as we discussed, it helps with the balancing the energies.
Yeah.
So once and the remedies in homeopathy are there which help to calm such reactive dogs.
Yeah.
So it helps to bring themselves with peace.
So like Lana keeps pawing.
That's
Will she calm down?
that's her nature of showing her love. So we want more of that.
We want more of this. Talk to
Yeah.
me. Yeah. Doc, do grooming salons get in touch with you on how to reduce stress for their animals that they're grooming? Or animals that do they consult with you?
Yeah.
They do in Bombay?
Bombay, a lot of grooming salons. Because the dog is in a new environment.
Yes.
Just consider a normal grooming scenario where the hair is being trimmed,
And the hair
the
dryer.
vibration of the machine, the loud noise of the hair dryer.
So they consult.
Yeah. So in these cases, bark flower therapy helps
Okay, nice.
to help calm the pet down, make him more comfortable.
Yeah.
That way. So
Nice.
in such situations, bark flower therapy it's really helpful.
And do facilities which have large number of dogs, so whether it's a kenneling facility or it's a animal welfare center, do they reach out to you to figure out ways of reducing stress for their multiple animals in their facility?
Yeah.
They do. So they
know.
so Bombay is doing this.
Right.
Huh? Bombay welfares are doing
And I would
this.
like to support other facilities if they are open to it.
You'd
as
be
well.
open to it if they
Yes.
can they do
reach out? Yeah, we can do an online.
You
thing
can do
as
an
well.
online
Right.
consult. You're happy to do that.
And it's like medicines can be sent anywhere in like people take it.
Fabulous. So if you're a welfare or a
Just
kenneling
not
facility,
not in India. Like people are taking it abroad. Like I send medicine from Bombay. Yeah.
you're sending medicines
Yeah,
abroad.
bark flower, homeopathy.
Fabulous, doc.
So
So that's a great.
people abroad are reaching out. I hope people in
India do.
Yeah.
So now, if you are a facility which has multiple number of animals, you can always reach out to Dr. Akshay at AccuVet India to some help to reduce stress levels of animals in your facility. Because I seem to, I just feel that those lines are getting a little blurred where welfare is just about veterinary care.
Right.
And I think I just feel like it's a combination of multiple factors. So it is veterinary, but it is also reducing stress levels for animals to recover.
And that helps in the recovery. Like if the dog is and in a shelter setup, dogs must be from anywhere.
Everywhere.
And we don't know their nature, how they are.
Yeah.
So and when they interact with other dogs,
Yeah.
so that also increases their stress and
Yes.
anxiety. So,
Yeah, that stress transference happens. Because when we did the camp doc, we actually designed the layout in such a way where the dogs that came in were in one section, then the OT, and then the recovery dogs on the other side.
Okay,
We
so
had
then there's no
separated.
interaction and
So,
they
you know,
get
when
their
you-
time and peace.
So when you've come in, you're stressed. You don't know where you are, what's happening. The ones that were recovering when they're not picking up the stress of
Stress
the
and it's more like a peaceful.
experience, so that was great. Is there any advice you would give to a vet doc, who's thinking of getting into this, or anybody who wants to get into alternative animal healing modalities? Is there any advice you would give them?
So a lot of young vets now are reaching out to me, like they are interested in this
Yeah.
to learn acupuncture, to learn alternative therapies. There are a lot of people are doing Reiki also.
Yeah.
Yeah.
I used to do for
Yeah, I
Watsi
know. I remember.
and crystal healing.
Crystal healing.
Yeah. So Watson used to actually go cut when I used to give him Reiki.
Yeah.
But he used to go to sleep and I used to put crystals on him.
Oh, so yeah. Again, the
That they pick
form
up
of
the-
energy.
Yeah.
It helps that way.
Yeah. Wow.
So yeah, for as we were talking about the young vets, they reach out and then I tell them about the courses which they can do.
Yeah.
What is available in India, what is available abroad, and how they can educate themselves.
How do you navigate your own emotions, Doc, when you're
That is-
working with
yeah.
pet families? Because it's a lot, right?
Yeah, it's a little heavy. That's something I need to work on. But
Okay.
yeah, I'm
Do you
trying my level.
meditate?
I tried meditating and all, it didn't help because there are so many thoughts in your mind.
Yeah.
Your mind doesn't become stable at one place.
Are you open to getting mental health support? Vets do,
yeah,
right?
vets do require because
you're
it's
dealing...
too traumatizing mentally, physically, and people just exploit vets anyhow. It's like human doctors are also being treated that way, but it is difficult. Like your emotional stress, you're trying to help that animal can't speak.
Yeah, and then you're dealing with a pet family.
Then to make them understand, to calm them down.
You're dealing with three sets of emotions, right? The animal's emotions, the animal's caregiver's emotions, and then your emotions.
Yeah.
And your emotions at work, and then your emotions in your home.
Personal life. Yeah, it does.
That's a lot of emotions you're dealing with. I hope you're on Rescue Remedy, dog.
Yeah, sometimes it's required. Too much stress.
No, I mean, I really feel like, I mean, the more and more I meet people in the animal welfare space, I genuinely feel this support is needed because your work has such a huge emotional toll. You know,
and then your emotional should be in balance so that the pet heals properly.
Yeah, and your focus has to be the animal, but you're human at the end of the day, right? तो अगर डांट पड़ रही है उस साइड से तो बुरा लगता है. You know, whatever bit as much as you can, you have to balance that out. What is your advice for pet parents with senior animals? What would your advice be for them for palliative care for the animals?
Senior animals are like puppies. So be it their food, their daily activity, their walks, as they age gracefully, it has to be a happy journey for them.
Give them that dignity.
Dignity is there. They'll have issues peeing, pooping.
Support
keep them clean.
Yeah.
You'll have to lift them.
Yeah.
Make the house pet friendly for a senior dog.
For a senior dog.
Then you can offer them food in an elevated bowl. So then there's less stress on their joints, the spine, and see to it that they are happy. You don't give them more stress because of your doing.
So like if you lived on a first floor and the dog had to climb the stairs, you have to consider moving down on the ground floor so the dog doesn't have to do stairs.
A lot of people are doing that.
You have to do that. I mean, I remember I threw my bed out and I was on the gadda on the floor with Watsi, you know, because he couldn't climb the bed after a point. You were talking about eating dog, but isn't it recommended from the stage of puppy you have raised bowls so the dog doesn't get a spinal thing? And it has to be at the chest level of the dog to eat. For them. So these tips are very important.
From the beginning.
Beginning. So do you hand out stuff at the clinic? Or is this something that you feel would be helpful for pet families? Do they read?
I don't know. There's no point wasting paper. I don't like wasting paper.
Okay, fair enough.
Honestly.
So maybe
this just goes in the dustbin.
Yeah. So like perhaps maybe then just an email that goes out.
That also people don't read. So we're trying to make
videos,
reels to educate people.
Yeah, I think education and animal care at home and on the streets.
And all these are very simple, small tips.
And huge impact.
Yeah.
And so much change with these chotu things. So if for the pet parents and pet families that are watching this, if you had to give them 3 tips on what they can start for their animals, whatever age, today, 3 tips on animal health care and well-being, what would that be?
So for the well-being part, just be attentive, just observe your pet, because slight change in the behavior, the way your pet is behaving that day, will help save his life. Because if he's running a fever, if there is some kind of discharge from the nose or from the eyes, from the ears, just observe your pet as you play with him. Observe his body, feel for any lumps or anything on the body. Just feel your pet, play with him, then you'll understand him very well.
His body.
So that will help to, save time and pick up diseases or any condition quickly. Then next is about the nutrition part. Offer wholesome food. Understand your pet's nutrition and any stage of life that should, help him to be more comfortable and grow well.
Have a healthy life.
And again, lastly, for senior pets, make your house senior pet friendly. Understand their condition, their needs. They can't hear you. Slowly the vision goes away.
Also.
So then you have to be more understanding, attentive for small things.
Patience
is really important, because I've seen, unfortunately, I liked the pet was very nice. The family was nice. It's just a sad thing. Like now the dog has a tumor. He's 11. One leg is paralyzed. And they called me one day randomly, like, please, can you look for a old age home? I'm ready to pay money. And that broke my heart, and respect for that individual and family.
Yeah, because that is the time when they need you.
Yeah.
And so that's what I mean about responsible dog ownership, you know, or
So know
any animal.
What you're doing, getting into.
I mean, they are going to grow old, you know? Like, how would you feel if your family was like,
just abandoning you?
Chhod do tumhare ko, you know? It's just sad. And I feel it's because we need to raise the status of animals. They're not a commodity. They're living beings.
And they're part of your family.
They are your family, you know? Like, you can't just... How sad. So, Doc, if you had to give some tips to pet families about trying out alternative healing for their pets, what would you say?
So, firstly, you have to be open to accept results, and some cases you can see miracles also.
Yeah.
So, yeah, you just have to be open and ready to accept the energies of the universe, which are going to help your pet and yourself as well.
Yeah, together, right?
Yeah.
Yes. So thank you so much, Doc, for taking out time, coming, you know, letting us know about all these amazing things you do. Dr. Akshay Shah's clinic is called AccuVet India. You can find him on Instagram.
Yes.
Google his number. He'll be right there. And please take your doggies and cats and
even if you can't get them, we can help you online as well.
Yeah, you do Zoom consults as well?
Yeah,
okay.
We can do that.
Thanks, Doc. Thanks for being here today.
Pleasure.
Thanks.
And educating people. Hope people understand things we talked about.
Yes. Otherwise, you can just call up Dr. Akshay.
Yeah. Anytime.
Wonderful. Thanks, Doc. Thanks for being on the show. Well, I hope you enjoyed this conversation with Dr. Shah. It was really fun and interesting for me. Please leave your questions in the comments. We're happy to bring him back again. And please like, share, and subscribe to this podcast, and see you on the next one.